The CDC says the flu has been especially tough on kids, with over 100 children having died from the virus this flu season. While it's not a seasonal record, kids with underlying health problems are more at risk, and the latest data gives parents a stark reminder that flu can be devastating to any child. Joining us now to go over this year's flu season impact and how to keep your kids healthy into the summer is Dr. Evelyn Pangonis with Akron Children's Hospital. Thank you for joining us.
Thank you for having me.
What have you seen this year when it comes to the number of kids getting the flu, and are symptoms more severe?
So unfortunately, we are seeing a lot of kids getting hospitalized for the flu this year. So fortunately, it's less than last year, but there's still a lot of kids that are getting sick and having complications from the flu.
The CDC says more than half of the children who died from the flu this year had no medical issues before their infection. What factors make the flu potentially more dangerous for children?
So some of the issues are kids are more likely to get infected, probably because they're not good at containing their own germs and spreading it or they're good at spreading it to each other, and they may be contagious for longer. Kids also have smaller airways, and their immune system just may be more revved up, so they're more likely to develop a severe illness from the flu.
So with that being said, what are the best ways to prevent the flu?
Number one is get the flu shot. Number two is try to not get sick, meaning stay away from sick people, stay home when you're sick. Practice good hand hygiene, and cough and sneeze into your elbow.
You mentioned the vaccine. How old do kids have to be to get it?
So you can get it starting at 6 months of age. Your first flu season, your kids need 2 vaccines, and after that, you just need one flu vaccine every year.
What are some signs and symptoms to watch for if your child can't communicate to you that they just don't feel good?
Yeah. So, anyone who has the flu should talk to their pediatrician about whether or not he should get tested and/or start on medication, and whether or not they think that's a good choice for them. So common symptoms of the flu are fever, chills, runny nose, cough, fatigue. They may not look like they feel well. They may have this kind of this feeling of, or this overall look of sickness on their face. Signs that you need to watch out for as far as when you need to go seek immediate care are trouble breathing, fast breathing. If your child looks like they're if you have that parental instinct that something doesn't feel right, or if your child is not waking up.
The symptoms you just mentioned, that's when maybe you should go to a hospital as opposed to calling your doctor?
Yeah, so when to call the doctor is when you think your child has the flu, meaning they have fever, chills, maybe they're complaining of muscle aches if they're old enough to tell you that, or if they just look like they don't feel well. You should bring them to your regular doctor. When should you bring them to the emergency room? If they're too sleepy and you're not able to wake them up, if they look like they're having a hard time breathing, or if you feel like as a parent that your child needs immediate care, you should take them to the closest emergency room.
If your child does get sick, what are the best ways to help them as their body tries to fight off that virus?
So make sure that they stay hydrated, plenty of fluids. Eating isn't as important as fluids, so you want to make sure you push that. And then if they're within 72 hours of their illness, you can start on a medication that may help shorten their duration of illness.
Well, as parents, we hate to see our children suffering and sick. Let's hope that all the kids can stay as healthy as possible. Dr. Evelyn Pangonis, thank you so much for your time.
You're welcome.